6:16 right now, and for your health, does the day of surgery matter? A new study says yes. Dr. David Geyer here to break down the findings, and they are pretty alarming. We're talking about a significantly increased risk of death and complications for procedures immediately before the weekend.
Yeah, it really is something shocking if you haven't thought about it. It's been one of those things that's been talked about in the surgery world, sort of behind the scenes. If you were a patient, would you have surgery on Friday before the weekend or Monday after the weekend? And there have been other studies that have looked at different aspects, but this is the first one that looked at outcomes, deaths after surgery and within a 30, 90, and 100-day period, overall complications and hospital readmission rate. And it was statistically significantly more likely to have those complications if you had surgery on a Friday before the weekend than having it on Monday.
And obviously they measured a large group here. Why do you think this is the case?
Well, there's so many different variables that people speculate. The only one that they were able to track in their study was the experience level of the surgeons on Friday compared to Monday. The more senior surgeons typically operated earlier in the week and not on Fridays. That was all they could track. But other studies that have looked at various aspects of this have looked at things like decreased staffing, nursing and techs and things like that on the weekends, decreased experience of that staff, less ability for tests like MRIs on the weekend and cardiac caths and things like that. Normal procedures that are part of your post-operative protocol, removing Foley catheters from the bladder, getting the patient up out of bed and into a chair and walking, less likely to happen on the weekend. So there's a lot of different factors. This study didn't look at that, but all of those may play a role.
Wow. So what would be your suggestion to people listening to this at home being like, oh, I've got to schedule a procedure. Is it obviously you hear this and it makes you a little uneasy if you've got something going on a Thursday or Friday.
What was interesting about this is that this was all surgery. They looked at almost all surgery fields, and it was elective and emergent surgeries. So obviously you can't control when an emergency happens. That's a little bit out of your control. But for an elective procedure, my world of orthopedic surgery, that would be something like a joint replacement. Maybe talk to your surgeon about doing it earlier in the week so that you're out of the hospital before the weekend. But then just talk to your surgeon, because it may be, again, this is one hospital system. It has this, and this was in Canada. We need more of these studies done in the United States. I suspect that the same thing would be found, honestly, but it's looking at all those different factors. And if you are in the hospital over a weekend, have your family, have your friends a little more vigilant about talking to the nurses. Hey, can you come help with this or that? Just to make sure you're getting every aspect of care you need to recover.
And if you go home over a weekend, call the doctor, emergency line, whatever if you have some type of complication. I did have surgery on a Thursday and Friday. I'm still kicking.
Yeah, so the last surgery I had was on a Friday, but it was an elective surgery. I was home by 11 in the morning, and I think I wouldn't be as concerned about that. Where I'd be concerned was the surgery that you're admitted to the hospital after an elective surgery on Friday. Maybe I think about, I'll wait a few weeks and do it on Monday or Tuesday.
All right. Dr. David Geyer, always interesting to talk with you. Thanks so much.
Thanks.